This is Evaluating the Patient, Chapter 11 from Low Back Disorders by Stuart McGill. According to McGill, what is the most important element in all diagnoses? Is it A, MRI/imaging tests, B, functional screens and tests, C, history and mechanism of injury, B, your brain, or E, special tests? According to McGill, he believes that your brain is the most important element. He believes that if you can put together the history, the mechanism of injury, where their pain is, the special tests, you can decide the course of action and the treatment and what the most likely diagnosis is. You can decide if they need further imaging, further testing, or if you can treat conservatively and hope that the pain will go away. In your first clinician-patient meeting, you need to make sure that you observe everything: the way they walk, the way they sit down, how they hold themselves, do they have bad posture, their mood, do they seem depressed, are they really happy, things like that. You need to also make sure you get a really good history out of them, previous surgeries, past injuries, previous physical therapy, other medical conditions that they might have, in order to get a good picture of the whole patient. You also need to perform functional screens and tests to determine where the pain is coming from and what the potential diagnosis might be. You also need to make sure that you identify their rehabilitation objectives. Are they just trying to get back to everyday activity? Do they need to be at a certain level for their job? If they're just sitting at a desk all day, do they just need to be able to get back to doing that? If they have a certain job where they're moving around all the time and moving boxes, that's also something you need to consider. You also need to consider their age and their general condition. Are they really out of shape? Are they, in good shape and just have this one acute issue that we can take care of? You also need to identify their occupation and lifestyle details. Decide if they're just trying to get back to normal return to play or return to work activities, or are they a weekend warrior who wants to be able to play basketball on the weekends or, play in his softball league at night in the summers. You should also consider the mechanism of injury, whether it was an acute injury that happened or whether it was a chronic overuse over a long period of time that has just finally gotten to the point where they decided to get it looked at. So some of the special tests here are these are for compression of the spine if you are having low back pain. The heel drop test is just going up on your tiptoes and dropping down onto your heels, and it should elicit pain in the low back if you have some sort of compression injury. The seated compression tests, as seen in the video with the gymnast at the bottom here, also compress the spine to see if there's pain in the spine as well. These extension tests help to extend the spine to see if you are having pain with extension. The McKenzie posture test is the one here with the woman in the looks like a yoga pose. If you have pain with that, there might be something going on in your low back as well. And then the standing extension test also adds a little bit of rotation in there as well, and can help rule out certain injuries that it might be. For the neutral tests, you have your sitting slump test and the supine passive leg raise test. All of these are really good with nerve disorders or nerve injuries in your low back that then start to shoot down your leg if they're really severe. So based on those, which one of these is a compression test for back pain? The answer is D, the heel drop test. Name the two special tests for extension when evaluating back pain. That would be the McKenzie posture test and the standing extension test. Those put your spine into extension and a little bit of rotation to see if that's where the pain is coming from. So a lot of times there is a correlation between lumbar and hip problems. The pain that you get in your glute region can also be coming from hip pain or SI joint pain, So you need to be able to rule out and distinguish where the source of pain is coming from in the lumbar spine. Whether it's coming from the lumbar, or it's coming from the SI joint, or the various muscles or tissues surrounding the hip, or whether it's coming from the hip joint itself instead of the low back. There have been a lot of studies that show correlation between back troubles and then having either a previous hip injury or concurrent hip injury with the low back pain. So some postural tests that you can do to see if people have good posture are the standing posture, rising from a chair, the standing pattern, the gait pattern, and the manual iliac crest compression. These are all to see if you have good posture or what your posture is like when you're walking, sitting, standing, things like that, to see if your poor posture could be related to your low back pain. So here's some manual tests for control of motion. Your proprioception is also very important. There's one called the wall plank, and the goal of this position is to find the position that doesn't cause you any pain. So whether it's like in the picture here where she's pretty much at 90-90, or whether you need to go up a little further or down a little further on your elbows, depending on where your pain is and what gets rid of the pain. Spinal hinges are hinges of motion segments that bear more than their share of the motion, which is also very painful. And then the stiff spine is a term for muscular contraction that can lock the back into a painful position. So in conclusion, there are many different ways to evaluate the spine. There are many things you need to look at and evaluate, and you need to decide what's important. Whether the surgery from 15 years ago is really influencing this low back pain, or whether their low back pain is coming from a hip pathology. So with that being said, you need to look at the person as a whole instead of just their back or their low back pain. And then based on your clinical exam and using your brain to put everything together, you're probably going to have to decide what imaging tests you want to have done next.